Do you frequently feel bloated or tired after eating bread or pasta? What if I told you your body might be attacking itself when you eat something as common as a sandwich? That's what happens in celiac disease. Imagine your body sees gluten, a protein in wheat, barley, and rye, like an enemy soldier. So instead of digesting food peacefully, your immune system starts a war inside your gut. This war damages the tiny finger-like parts in your small intestine that absorb nutrients. Over time, this can leave you weak, even if you're eating plenty. Think of it like a broken vacuum cleaner. It's plugged in and running, but it can't pick up dirt. Your body is working, but it can't absorb the good stuff from food. So what causes this internal battle? It's mainly gluten, yes, that protein hiding in pizza, cookies, and even some sauces. But not everyone who eats gluten gets celiac. It only happens to people with a genetic red flag, usually in genes called HLA-DQ2 or HLA-DQ8. Think of it like a family password. If your parents passed it to you, you're at risk. But genes aren't the whole story. Sometimes, a trigger like surgery, infection, or even severe stress wakes up the disease. For example, Sarah felt fine for 35 years until she had a bad stomach infection. Then she started feeling awful every time she ate bread. Her body had the gene, but the illness turned it on. How do you know if you have celiac? Signs can be sneaky. Some people get belly pain, diarrhea, or constant gas, like John, who joked that his friends avoided sitting next to him after lunch. Others feel tired all the time, lose weight without trying, or have bone pain because their body isn't absorbing calcium. Kids might fall behind in growth or act moody. Some people even get itchy rashes, called dermatitis herpetiformis, on their elbows or knees. And here's a twist: some people have no gut symptoms at all, just anemia or frequent headaches. So, if your body seems to be starving despite eating well, celiac could be the hidden thief. Getting a diagnosis means teaming up with a doctor. First, blood tests check for attack signals, antibodies your body makes when fighting gluten. But you must still be eating gluten for the test to work. Imagine testing a smoke detector only when there's smoke. Then, if blood results are positive, a doctor may do an endoscopy, a thin camera down your throat to take tiny gut samples. If the villi, those nutrient-absorbing fingers, are flattened, that's celiac confirmed. Treatment: no meds or quick fixes. Just one rule: 100% gluten-free for life. No cheating, not even a crouton. Maria learned this the hard way. One slice of pizza led to 2 days in bed. But with gluten-free oats, rice, and clean-labeled foods, most people feel better in weeks. Can you prevent celiac disease? Not exactly. You can't change your genes, and we don't yet know how to stop the trigger. But if you have a close relative with celiac, you can get tested early, even without symptoms. Think of it like checking for high cholesterol before a heart attack. Also, for babies, recent advice says, introduce gluten gradually between 4 and 6 months while still breastfeeding. This might train the immune system gently. For diagnosed people, prevention means preventing damage. So avoiding gluten is like locking the door before the thief comes back. Scientists are working hard on better solutions. Right now, the big focus is on drugs that could detoxify gluten or calm the immune response. One trial tested a pill called latiglutenase that breaks down gluten in the stomach, like adding a bodyguard to neutralize the threat. Another idea: a vaccine to retrain the immune system, not to overreact. Also, new lab-grown gut models organoids help test treatments without harming patients. And smart apps now scan food barcodes to check for hidden gluten. So while the gluten-free diet is still king, the future might bring backup plans